The MRI machine incident. It was a Wednesday morning at Memorial Hospital in New York. A 52-year-old maintenance technician received an urgent call. One of the hospital's MRI machines was malfunctioning and needed immediate repair. This wasn't his first time working on these machines. He had done it dozens of times before. He grabbed his tool belt, loaded with wrenches, screwdrivers, and metal clips, and headed to the imaging room. When he arrived, the machine was powered down and safe. Or so he thought. He stepped inside the massive tube to inspect the internal components. His tool belt hung heavy on his waist, metal tools clinking against each other as he moved. Then, without warning, the machine roared to life. A catastrophic electrical malfunction triggered the magnetic field at full power. 60,000 times stronger than Earth's gravity, activated in an instant. His tools immediately reacted. The wrench on his belt violently ripped free and shot toward the machine's core like a missile. But it didn't stop there. His entire tool belt began dragging him deeper into the machine. He tried to pull himself out, but the magnetic force was unstoppable. His body slammed against the metal walls. Then the real horror began. The metal fillings in his teeth were ripped forward, tearing through his gums as his jaw stretched unnaturally. Blood filled his mouth. The heavy tool belt crushed into his abdomen with immense pressure, snapping his ribs one by one. Screwdrivers and metal clips stabbed into his sides, pinning him like a specimen. He couldn't breathe. He couldn't scream. His colleagues outside heard the commotion and desperately tried to shut down the machine, but the electrical malfunction had locked them out of the controls. For nearly 2 minutes, he remained trapped, crushed, and bleeding inside the machine that he came to fix. When they finally restored power and shut it down manually, his body fell limp. Massive internal bleeding, punctured organs, shattered ribs. He was pronounced dead at the scene. The man who spent his career keeping these machines safe became their final victim. Always respect the power of what you're working with. May this man's soul rest in peace. The oxygen tank explosion. It was a quiet Sunday evening at a hospital in Tampa, Florida. An 81-year-old retired veteran was recovering in his room after hip replacement surgery. He had been doing well, breathing through an oxygen tube connected to a large tank beside his bed. The old man had been a smoker his entire life. 70 years of cigarettes, and even now, hospitalized and hooked to oxygen, he couldn't shake the craving. Late that night, when the nurses finished their rounds and the hallway went silent, he reached into his bedside drawer and pulled out a pack of cigarettes he had smuggled in. He knew the rules: no smoking near oxygen. The signs were everywhere. But after days without a cigarette, he convinced himself that one quick smoke wouldn't hurt. He pulled out a cigarette, placed it between his lips, and flicked his lighter. The tiny flame sparked to life, and in that instant, everything changed. The oxygen feeding into his nose was still flowing. Pure oxygen, highly flammable. The flame touched the oxygen stream and ignited immediately. A jet of fire shot from his nose like a flamethrower, engulfing his face in flames. He screamed and jerked backward, knocking over the oxygen tank. It hit the floor hard and the valve snapped off. The pressurized tank became a rocket. It launched across the room, spinning wildly, smashing into the walls, the bed, the medical equipment. Flames spread instantly. The curtains caught fire, the bed sheets erupted. Then the tank slammed into the wall-mounted monitor and the entire room exploded in a fireball. The blast blew out the door and shattered the window. Nurses down the hall were thrown to the ground by the shock wave. When the fire team finally extinguished the flames and entered the room, there was nothing left. The man's body was burned beyond recognition. The hospital room was a charred crater. All because of one cigarette, one moment of weakness. Follow hospital rules. They exist for a reason. May this man's soul rest in peace. The electroshock therapy incident. It was a Monday morning at a psychiatric facility in Massachusetts. A 38-year-old woman was admitted for electroconvulsive therapy to treat her severe depression. ECT involved sending electrical currents through the brain to trigger a therapeutic seizure. It was her last hope after everything else failed. The medical team prepared her. Electrodes on her temples, mouthguard inserted, arms and legs strapped down. The anesthesiologist sedated her, and she drifted, unconscious. The psychiatrist stood at the control panel, ready to deliver the pulse. Standard procedure was 150 volts for a 30-second seizure, but something went catastrophically wrong. A technician had miscalibrated the machine during maintenance. Nobody noticed. When the doctor pressed the button, the machine delivered over 450 volts. Triple the dose. Her body immediately went rigid. Not a controlled seizure, but violent convulsions. Her back arched so hard that her spine cracked. Her arms broke free from the restraints, snapping the straps. Her legs kicked wildly, slamming the table. The current continued flowing for nearly a full minute before someone hit emergency stop. Smoke rose from the electrodes. Burning flesh filled the room. When it stopped, her body collapsed. No pulse. They performed CPR for 20 minutes, but the electrical overload had fried her nervous system. Her brain was destroyed. She never woke up. The technician was fired, new protocols implemented, but she was gone. Always double-check your equipment. One mistake can be fatal. May this woman's soul rest in peace. The elevator crash incident. It was a Thursday afternoon at County General Hospital in Chicago. A 29-year-old nurse was transporting a post-surgery patient from the 8th floor to the 3rd floor recovery ward. The patient, unconscious on a gurney after appendix removal, was hooked to an IV and monitors. The nurse wheeled the gurney into the freight elevator and pressed the button for the 3rd floor. The elevator lurched downward and began descending. Between the 7th and 6th floors, she heard a metallic snap, then another. The elevator cables were breaking. One by one, the steel cables snapped under stress. The elevator had been overdue for maintenance for months, ignored to cut costs. The elevator started dropping, slowly, then faster. The nurse grabbed the gurney, knuckles white. The patient had no idea. The emergency brake tried to engage, but corrosion made it useless. Free fall. 5 floors. The nurse screamed as the car plummeted. The gurney slammed into walls. IV pole toppled. Equipment scattered. 4 floors. 3. 2. Impact. The elevator hit bottom at terminal velocity. Metal crushing metal. The floor buckled upward. The nurse's legs shattered. The gurney launched upward. The patient's body thrown against the ceiling, then crashed down. When rescue teams pried open the doors 2 hours later, both were dead. The nurse from internal injuries. The patient never woke. The shaft became their tomb. Regular maintenance saves lives. Cutting corners costs them. May their souls rest in peace. The surgical light incident. It was a Friday evening at a private hospital in Los Angeles. A 44-year-old businessman was undergoing emergency gallbladder removal surgery. The operation had been going smoothly for over an hour. The surgical team worked under the massive overhead light, a piece of equipment weighing nearly 300 pounds suspended from the ceiling by a mechanical arm and bolts that had been there for 15 years. The hospital had received multiple warnings about replacing the aging mounting system, but management kept delaying it. Budget cuts. The surgeon made his final incision, carefully removing the inflamed organ. Just a few more minutes and they would be closing up. Then, without warning, a bolt in the ceiling mount gave way. The surgical light swayed slightly. The surgeon looked up, confused. Before anyone could react, a second bolt snapped. The massive light fixture tilted violently. The surgical team froze. The light hung at a dangerous angle, directly above the open patient. Then the third bolt broke. The entire 300-pound surgical light came crashing down. It fell directly onto the patient's exposed abdomen. The metal housing crushed through his open surgical cavity, smashing organs, severing arteries. Blood sprayed across the operating room. The surgical team screamed and tried to lift the light, but it was too heavy, too embedded. The patient's body was pinned beneath it, his chest cavity completely destroyed. Alarms blared. His heart monitor flatlined within seconds. They tried to remove the light, to stop the bleeding, to do anything, but there was nothing they could do. The weight had crushed his liver, punctured his lungs, and severed his aorta. He was dead before they could even lift the light off him. The surgeon stood frozen, covered in blood, staring at the catastrophe. Equipment failure, ignored warnings. A man who came in for routine surgery never left the table. Maintenance is not optional, it is life or death. May this man's soul rest in peace. If you made it this far, hit that subscribe button, drop a like, and comment which incident shocked you the most. Stay safe out there.